to it.
Thank you. That was it makes us all feel very emotional as you were talking. It was very nice to hear the actual words and the credit that Hazrimam gave to you for this work that you did. And I'm sure all of us in the community are very grateful for bringing this project to AKU and supporting the Jamaat in large numbers in Karachi and Kenya. Naima, do you want to start with the questions?
Yeah, sure. So yeah, Ali Madad, so just to echo what Altaf said, thank you for such a thought-provoking talk, and especially for sharing such beautiful memories with us. So there's a couple of questions that have come in the chat that I'll start off with and then go to some of the hands that we've got raised. So someone's asked us, if young South Asians are at risk and are not likely to be screened, and therefore probably have to pray privately, would you suggest that they pray privately, or should they still go to their normal doctor to seek advice and try to push for those tests?
That's an excellent question. I mean, it's all right to say that we are at risk, but what does the person have to do now to be able to be assessed properly? And so that if he is at risk, appropriate treatment program can be undertaken so he doesn't end up getting the heart attack. That's the crux of this question. It's a very good question. So if you are from a family where a cousin had a heart attack in Nairobi and now you're thinking about yourself, or you went to a talk like this and now you think, my goodness, I should be checked and what should I do? The first and the most important thing is to have what is called cardiovascular risk assessment done. And cardiovascular risk assessment is a pretty straightforward thing. Some good family doctors can do it, but most cardiologists can do it extremely well. And what do I mean about that? Remember I talked to you about those cardiovascular risk factors? Is it possible to show the slides that I'm showing rather than just my face, Altaf?
Yeah, your slides are showing.
We can see your slides.
We can see the slides? Fantastic. Yeah. I don't know. It's all right. You don't have to worry about seeing my face. All right. So this chart helps you decide what your cumulative risk is of getting a heart attack. So this is, your age and your sex. It's not that how often you're having sex. It's about gender, male or female, the premature vascular disease, family history, the lifestyle factors, the risk factors of high blood pressure. All of these can now be put into your little calculator, which can be on your iPhone or on your computer, and you can do it all yourself if you have all that numbers. But your doctor can do it, or your cardiologist can do it. And what you come up with is whether you are at low risk, medium risk, or high risk. And if you are in the medium to high risk, and you are a South Asian, you must go on to what I call secondary level testing. So the primary level testing is just the ECG and the blood work and the cholesterol level and the blood pressure. That's all primary level testing. And you can put all those in here and get yourself a risk profile in your cardiologist or a family doctor. And you should insist on that. And you should insist and say, yes, I need to understand the risk. This happened to my cousin. I heard about this. I mean, are you telling me that I'm going to be fine? You can't guarantee that. So put the onus back on the doc. And so it is then not a question of whether it's needed or you can be screened or not screened. There is need for it, a medical need, and therefore it would be done. So the secondary level testing are tests like a stress test on the treadmill, or a nuclear scan, stress test with a nuclear scan, or an echocardiogram, or what we now call a CT angiogram. And of all the tests we have in cardiology today, I will tell you the one test that is the most effective in picking the fact that you have disease or not, telling you how bad your disease is, where the blockages are, which arteries are involved, and giving you an idea of what is most likely to happen to you in the next 5 or 10 years is the CT angiogram. People go for this calcium score that is just the first part of the CT angiogram, and that gives you a lot of information. But what you need is to get a CT angiogram where they inject the dye into your artery. You just go in as an outpatient. They take the pictures in a CT scanner, just like a CT scan of your chest. And then you get off the table in 2 minutes and you just drive home or walk home, and that's all done. So it is a very relatively non-invasive, highly easy, effective test that gives you the most amount of information. So whenever there is a concern that a South Asian is in the medium to high risk range, having done the risk analysis, what you want is to somehow get yourself to a CT angiogram. And from that point on, the whole pathway of your life with cardiovascular disease